Deborah Villeneuve. I'm one of the gynecologists at Coordinated Health. I work mostly through the Allentown campus. When I was younger, I always enjoyed the math and science programs in my school, and I always thought I would do a job in those fields. Once I was a teenager, my grandmother became very sick, and she moved in with us, and my mother took care of her. I realized that I had to go into healthcare or some type of research that I would be able to help other people. I went to school at University of Pittsburgh. I was lucky enough to complete my medical school at the University of Pittsburgh. From there, I moved to Baltimore, and I did my residency at Franklin Square Hospital, which is a medium-sized hospital where I did my residency. It was a very impressive training program. At that point, I wanted to be a surgeon. I just loved being in the operating room. It's a very challenging, very rewarding experience. However, at Pitt, when I did my very first delivery, I changed my plan and went into obstetrics and gynecology. The obstetric portion is very rewarding. It is such a thrill to be part of a delivery, and then you get to take care of a woman through the entire course of her pregnancy. Delivering babies is such an awesome thing, but you can't do everything, and so I decided to limit my lifestyle to just gynecology. At Coordinated Health Gynecology, we can take care of patients of all age groups. We can start out in adolescence with women who are starting their reproductive process. We go all the way up into geriatric medicine, including menopause and treatment of the elderly. Aside from the obvious that we have a multidisciplinary facility at this time, I think the gynecology department is different than some of the other ones in the Lehigh Valley because we only do gynecology. We don't have to run off to do deliveries. We have very flexible schedules. We also have facilities where if a patient came in for her yearly, she can come in and have her ultrasound, have a bone density screening all on the same day. Many women may have problems with abnormal uterine bleeding and may require surgery such as D&Cs, hysteroscopy. Another procedure that is very popular today is endometrial ablation, which helps women with their abnormal bleeding. We can also perform laparoscopy, tubal ligations, evaluate patients for pelvic pain, endometriosis, ovarian cysts. Some of the more common conditions that I see in gynecology would be reproductive age, women who are coming in for abnormal periods, menstruation, pelvic pain, contraception, problems related to menopause, libido. There are some surgical conditions that we take care of, most of them related to abnormal bleeding. Although the standards have changed somewhat in different organizations, we still recommend a yearly gynecologic exam. So many women do not have a primary care physician, and the gynecologist is their only source of primary care. And so it's very helpful to come in once a year so that we can address any issues that may not even be specific to gynecology. I do have many interests. The bulk of my time is taking care of my 3 children. They're very involved in sports and school. Myself, I actually like to do a lot of outdoor activities. I'm very interested in landscaping. I like to scrapbook. I like to paint. So not that I have much time for all those things, but I do enjoy a lot of different activities. I think that what makes Coordinated Health special compared to the other gynecology departments that we have in the area is that we like to make every patient feel that they're very unique, that they're just not another patient coming in to fill a schedule, and that we are very interested in taking care of them and their well-being, not only gynecology, but as a whole.